Codetree initiative.
Hello, and thanks for joining us today. We're diving into something quite important, the Codetree initiative. I'm Liam.
And I'm Chloe. So Codetree is a platform that's really unique in the healthcare space. It focuses on sharing real medical stories. Stories that often get buried under paperwork, confusing bills, or just the sheer complexity of hospital systems.
Exactly. And what really makes Codetree stand out is its origin story. It was founded by Lowell Unruh, who went through some serious and, honestly, frightening medical challenges himself. His personal journey, well, it exposed the gaps and frustrations that patients face every day.
Right. And it's important to highlight that Lowell's experience wasn't just about surviving illness. It revealed something deeper: how patients often feel lost in the system. Overwhelmed by bureaucracy, unclear communication, and a real lack of accountability. That frustration was the spark that led to creating Codetree.
Yeah, and I think it's worth pausing on that. Because when we say lost in the system, what does that really mean? It's not just about paperwork or waiting times. It's about feeling unheard, invisible even, in a system that's supposed to care for you.
Exactly. And Codetree isn't just about clinical recovery or medical facts. It's about clarity and empowerment. Lowell wanted a platform that goes beyond the technical side of healthcare to address the emotional and practical challenges patients face.
So let's dig into the problem Codetree is tackling. Healthcare systems are notoriously complex and bureaucratic. Patients often encounter confusing paperwork, opaque billing processes, and fragmented communication. These aren't just minor annoyances. They can actually lead to unsafe or unsatisfactory care.
That's a key point. And I'd add that these issues often compound. When you're dealing with a serious health issue, the last thing you need is to be bogged down by unclear bills or conflicting information from different providers.
Right. And often patients have nowhere to turn for clear answers or understanding. That gap, that space where patients feel stuck, is exactly what Codetree aims to fill. It's about making those invisible problems visible and understandable.
So how does Codetree do that? The platform shares real patient experiences, interviews, and community discussions. But what's really important is the way these stories are framed, using clear human language. No jargon, no complicated reports, just straightforward, relatable storytelling.
That's a smart approach. It acts as a bridge between the complex healthcare system and everyday people trying to navigate it. You know, that metaphor really captures Codetree's role, connecting two worlds that often don't communicate well.
Yeah, and it's not just storytelling for storytelling's sake. These narratives highlight systemic issues and foster understanding. They create a space where patients' voices are heard, and where healthcare professionals and policymakers can learn from real experiences.
Speaking of audiences, Codetree is designed for a broad range. Patients looking for clarity and support, healthcare professionals who want to improve care by understanding patient realities, policymakers who need insight to shape better policies, and even anyone curious about the human side of healthcare.
That broad reach is important. It means Codetree's impact isn't limited to one group. It encourages dialogue across the entire healthcare ecosystem.
I want to ask you, Chloe, do you think this kind of platform can really influence policy or clinical practice? Or is it more about patient support?
Good question. I think it's both. By sharing real stories in accessible language, Codetree helps patients feel less isolated. But at the same time, those stories provide valuable insights for professionals and policymakers. It's a way to ground decisions in lived experience, which is often missing in healthcare reform discussions.
That makes sense. And it ties into the why behind Codetree. At its core, the initiative exists to make healthcare less frightening and more accountable. It's about fighting for patient satisfaction that goes beyond just feeling better physically.
Yes, it's about getting the right answers, clarity, and fairness. Lowell's vision was to create conversations that matter. Conversations that can drive real change in healthcare systems.
And that's a powerful mission. It's not just about individual stories, but about systemic improvement. Using storytelling as a tool for change, not just entertainment.
Absolutely, and I think Lowell's personal story really grounds the initiative. It reminds us that behind every policy or procedure, there's a person navigating a difficult journey.
Looking ahead, Codetree plans to share more of these real stories in upcoming episodes. We'll hear about struggles, surprises, and those human moments that really matter.
That's something to look forward to. These stories will be eye-opening and, hopefully, empowering for listeners.
Before we wrap up, Chloe, what do you think is the most important takeaway for our audience?
For me, it's that healthcare complexity isn't just a technical problem, it's a human one. Codetree's approach of using storytelling to bridge that gap is both innovative and necessary.
I agree, and I'd add that Lowell's experience shows us the importance of clarity and accountability in healthcare. It's not enough to just treat the illness. You have to support the person.
Well said. So to sum up, the Codetree initiative is about giving patients a voice, fighting for clarity and fairness, and making the healthcare journey a little less daunting.
And for those listening, stay tuned for the upcoming episodes where we'll dive deeper into these stories and the lessons they bring.
Thanks for spending this time with us. We hope you found this introduction to Codetree insightful.
Until next time, take care.